Hello there and welcome to the video. So this is just new on the BBC website. Heart doctors held back stent death data. Yes, so a stent is a tiny tube, metal or plastic, that your doctor can insert into a blocked passageway to keep it open. Now I know from doing research on this before, there's a lot of controversy around stents in that there's a growing number of medical experts who say that stents are just being put in place and used basically willy-nilly. And this may be some of the evidence behind the willy-nilly part. Not very technical, I know. But the thing is, I'm writing quite a large script for a video that I'm going to turn into a book, looking at just how much fraud there is in the medical industry. And this is from universities and from research organizations as well. It is shocking how much fraud is going on, and purely for money. And I'll come to that in a second. So let's have a look at this article, because this is just diabolical. It really is. So it says doctors working on a clinical trial for treatment of health disease held back key data. Newsnight has been told. And Newsnight's sort of investigative journalism. What is it? A BBC news program, and they do a lot of exposés like this over the years. It says the XL trial tested whether stents were as effective as open heart surgery at treating patients with a heart problem called left main disease. The data suggested more people fitted with stents were dying after 3 years. It was eventually published, but only after treatment guidelines that partly relied on the trial had been written. So they waited to release the information that was critical to whether people would die or not until after guidelines were written. Now, it takes a long time for guidelines to be retracted, and we'll come on to retraction of medical data in a second. These guidelines recommend both stents and heart surgery for certain patients with left main disease. In the trial, sponsored by a US stent manufacturer, Abbott, half the patients were given stents, the other half had open heart surgery. When the first results were published in 2016, you see what I mean? This was done in 2016, and all of the guidelines are written. We're now in 2020. Was that 4 years later? Almost, well, you're 40, I was going to say almost 5 years, but it's only 4 years later. So all of that guidance has been put out in the medical domain, I won't say the public domain, and people's lives are being decided based on those guidelines, which say to give people this stent created by Abbott, who were the company that sponsored. I mean, yeah, you can imagine how bad that could be and what could go wrong there. The doctors doing the trial knew there was data about what happened to some of the patients 5 years after their stent or heart surgery procedure, but they chose to look only at what happened up to 3 years after the patient's procedures and published that data. So they didn't publish the data from the 3 to 5 year period. Absolutely appalled. Professor Nick Freemantle, a biostatistician at University College London, said if somebody had died 3 years and 1 day into the trial, that death wouldn't have been counted in the results. I'm absolutely appalled that they've done this. Newsnight has seen information shared between people involved with the safety of the trial that suggested things were starting to look worse for people with stents after 3 years. More people were dying than those who had had surgery, but they decided not to publish or share that data. They decided to let guidelines be written. And I mean, this is just my opinion, but I would say that they're complicit in the deaths of those people afterwards. Newsnight has seen the review. It said that the evidence suggested stents were worse than surgery for those with left main disease. Newsnight has previously reported that the same trial failed to publish certain heart attack data that cast stents in a bad light. So this isn't the first time they've been doing this. This is just golden. The researchers carrying out the trial have agreed to an independent review of the raw data. Various names have been put forward by the researchers and the European Society of Cardiology about who is doing the analysis. They all have ties to the researchers, guidelines process, or medical device industry. Like they want to double down on their fraud. It turns out that all the main doctors working on the trial and the lead doctor writing the guidelines for left main disease have declared financial contributions to either themselves or their institutions from companies that manufacture stents. Shocking, appalling, disgusting, but it's just the tip of the iceberg. It's rife in the medical industry. And let's have a look at why. This is the British Medical Journal, and they say research misconduct can harm patients, distort the evidence base, misdirect research effort, waste funds, and damage public trust in science. Countries all over the developed world are now recognising the need to set up systems to deter, detect, and investigate research misconduct. Why does the United Kingdom have no plan to do the same? It turns out that we have no official body looking into research fraud like that discovered by the BBC. Makes you wonder, doesn't it? So let's have a look a bit further at this. This is part of some other research that I've discovered. And this is by a chap called Edward Archer, PhD MS, and he currently serves as Chief Science Officer for EvolvingFX. And he wrote an article, and this is jamesgmartin.centre. My experiences at 4 research universities and as a National Institutes of Health Research Fellow taught me that the relentless pursuit of taxpayer funding has eliminated curiosity, basic competence, and scientific integrity in many fields. American universities often produce corrupt, incompetent, or scientifically meaningless research that endangers the public, confounds public policy, and diminishes our nation's preparedness to meet future challenges. Funding from public health research increased 700%. The number of retractions of biomedical research articles increased more than 900%, with most due to misconduct. You don't have to look very far to see how much corruption there is, to see people who are quite willing to promote products that they don't believe in, have never tried, and just for money are promoting to people because they're getting paid to. And it's the same, I'm afraid, in universities and research organisations. People are getting paid millions of pounds to sign their name to a product. People are getting paid millions of pounds to falsify research. There's too much evidence. I see it come up again and again and again. And I'm afraid it doesn't matter how intelligent you are, you can be bought out by an organisation and your values sold for £1 or $1. I started this channel thinking that, I'm not sure there's going to be enough information to, basically constantly report on fraud in the health industry. But I'm afraid every day, it's not almost every day there's articles appearing that are another example of research fraud and fraud in the health industry and fraud by academics and fraud by institutions, and basically people and organisations being bought by companies. I'm not going to name the companies, but being bought by companies. There's just so much of it. I'm shocked, I'm appalled, I'm disgusted. So this is just another example. I hope you enjoyed the video. This kind of video isn't going to be promoted by Google or YouTube because I'm afraid They're complicit in this as far as I can tell. So they're not going to promote this. It's only going to be shared if you share it for me. So please share it on Twitter. Please like it. Please subscribe to my channel. Please tell other people about this, because there's a lot of information that are in my videos that can help you, help your family, help your loved ones make a better decision about your health. Take care, see you soon, and goodbye.